there, welcome to the Newest Matters conversation on creating a community of care. My name's Nadine Nakagawa. I'm a city councillor here in Westminster, and I use the pronouns she and her. I'd like to start off by acknowledging that we are on the unceded territory of the Hunkaminam and Halkomelem speaking people. And as the original capital of BC and as what we're still known as the Royal City, it's really important that we work to acknowledge the truth of our history and reconciliation with the First Nation whose territory we're on. Yesterday was also the National Day of Action on Murdered or Missing Indigenous Women, and the report with the calls for action touch all all levels of government, federal, provincial, and municipal. And so there's a lot of work there still to be done. And that really connects nicely with the conversation here today. I will first note that we have closed captioning. So if you do need that service, we do have the captioning available for you. If you go to the bottom of the screen and click on live transcript. And I'm here today with Esther Sia from the Executive Director of the Umbrella Multicultural Health Co-op, and Linda Fletcher Gordon, the Acting Executive Director and Supervisor of the Health Contact Center for Lower Mainland Purpose Society. We're going to start off this evening by sharing our video, the video that the City of New Westminster put together to submit to the Provincial Committee on Reforming the Police Act, just to give a bit of a primer for this conversation before we get started.
I'm Nadine Nakagawa, and I'm a city councillor in New Westminster. We're in the middle of a difficult and important conversation about what community safety means. At the City of New Westminster, we are submitting a report to the Provincial Committee on Police Reform with our views about how to make our community safer. This includes public safety initiatives, honouring our heritage, embracing new technologies, building partnerships, and continuing to educate ourselves and the community. Like everything we do at the City of New Westminster, we're constantly reviewing our policies, programs, and initiatives to make sure we're reflecting the needs of our dynamic and growing community. We need fundamental changes in the policing model to move away from a focus on enforcement to address the root causes of social issues that disrupt our community's quality of life and well-being. We can create a safer, more inclusive, vibrant community by providing the right resources in the right places, and that doesn't always mean policing. What we need is housing, healthcare, and community services so all members of our community have the chance to thrive. Our city's police reform working group has worked collaboratively with our community to develop a response to the province's call for input regarding public safety and policing. We've concluded that bold steps are needed to lift up the most vulnerable, especially those experiencing mental health crises, poverty and homelessness, and people from racialized communities. We also know that we need different approaches to issues like domestic and sexual violence, which we refer to as crimes of power. We understand that the structures put in place to protect the status quo too often harm those with the least power in our communities. Our recommendations reflect our community vision to create a place of compassion and inclusion. We believe everyone in our community should have all their basic needs met, and this includes having a home, access to food, integrated health services, and full employment, and programs with a livable income. Our city is advocating for an allocation of resources to where they are needed the most. Our approach is based on 4 core ideas. Number 1, developing a new model of community response that relies on a full spectrum of services to address public safety. Number 2, centering those who have been negatively impacted, including racialized and vulnerable populations, with a focus on compassion and care. Number 3, enhancing and expanding the collection of data and its analysis so that we can make more informed decisions about public safety and related issues with leadership from the impacted communities. Number 4, we're forming police boards to provide greater accountability at the community level. New Westminster is a forward-thinking, compassionate government committed to fostering individual and community resilience. The city is actively collaborating with the New Westminster Police Department to take bold action to create positive change. Our city police force has already taken concrete steps to provide compassionate response to calls for service that fall outside of the traditional mandate of policing. However, the police department cannot be the only vehicle for addressing the core social issues that impact public safety. We are at a pivotal time in our community. We have a unique opportunity to advance public safety and security away from its colonial and paternalistic structures, in favor of a model that is solidly built on the values of compassion, social justice, and inclusion. A model that allows all members of our community to feel that they belong and are included. By refocusing our approaches, our decisions, and our actions, we can achieve positive change. We urge the province of BC to join us in embracing an innovative, inclusive, and community-based vision. That this conversation has started gives me hope. Thank you.
Great. Well, more conversation, so more hope. This is really good. So first of all, thank you so much to Esther and Linda for being here with me tonight. Your organizations, your staff, your volunteers, and you yourselves have been on the front line of the crisis and all the competing crises. So I really want to note that I know your time is so valuable. So much appreciation to you for being here tonight and the work that you do. Can you tell me a bit about your organization, yourself, and the services offered? And Esther, will go to you first.
Thank you, Nadine, and thank you for this opportunity to join this conversation, and welcome to all the participants. I can't see you, but thank you for deciding to spend some time with us. And I'd also like to acknowledge that I'm calling in from the unceded territories of the Squamish, Musqueam, and Tsleil-Waututh people. And in an introduction to who I am and our organization, as Nadine, you have mentioned, I'm the Executive Director of the Umbrella Multicultural Health Cooperative. And we're located on Carnarvon Street, right across from the Hideout Cafe and beside the Law Courts. And we provide health services and social services for those who self-identify as having language and cultural barriers accessing services. Our programming includes, we have a mobile clinic that travels throughout the Fraser Valley to provide primary care to the migrant farm workers who come from Mexico and Guatemala. We have a pediatric and family practice clinic in our location on Carnarvon Street. And we also have volunteer led groups, and that's actually funded by the City of New Westminster. And we're also hoping to launch, planning to launch a health promotion program later this fall. And we're also hoping next year, as part of our expansion, that we will also be expanding our clinical services to start accepting new patients. So that's us in a nutshell.
Wonderful. Thanks so much, Esther. So many different services provided there, and another organization that provides a lot of different services. Linda, can you tell us a bit about your organization and the services provided there? And I think we actually have a slide for this as well.
I'm not going to use the slide because I don't want to take up a lot of time, but I'm acting executive director of the Purpose Society. And in that capacity, I supervise one of our services, which is a safe consumption site. But Purpose has been around since 1983, and we have just such, we're called a multi-service organization, and that's because we have such a variety of services. We have an independent schools, that's one of 11 schools in the province of British Columbia that's designated for special needs kids. We've got lots of counseling services for children, youth, and families. We have a staff member who is part of the Welcoming Communities Committee in New West. There's a big part of what we do is harm reduction, and we do harm reduction distribution, but a lot of ancillary services around that. And we provide the services not only in New West, but the north side of Fraser Health Authority. So that means Tri-Cities, Maple Ridge. We have people working in Abbotsford and Chilliwack and Mission. And so, you know, we have kind of a good overview of what's happening on the street in a lot of the communities. As part of the services that are part of harm reduction, we have a primary health clinic for both youth provided by Fraser Health and adults. And that clinic is provided by a Vancouver Infectious Disease Group. We also, going along with that, have housing services, and we have two programs. One is the New Westminster Rent Bank, funded by New West, and the other is funded through Reaching Home funds. Both of those services have been incredibly important over the last year, and just a huge number of people have come looking for housing and also some financial help in terms of keeping their homes. We have a huge food delivery program. We deliver hampers, and we deliver food off our van when we do the harm reduction piece. And we also have food distribution from the building. And currently we're feeding or distributing food to depending on the week, between 750 and 850, 900 people a week. So that's what we do in a nutshell.
Wonderful. Thank you so much for that. Just in a nutshell, it's a small amount of work being done by these organizations. So we have a number of overlapping crises right now. We have the housing crisis, which I think everybody's been hearing about for years and years, but still going. We have the opioid or poison drug supply crisis that is taking a huge amount of lives in our community. We have a climate crisis, and we have a pandemic, which is a lot to deal with at one time. Linda, could you talk a bit more about some of those trends that you're seeing in response to all these multiple overlapping crises?
Well, housing is, you put it up on the screen earlier. Housing is just such an important and very practical matter. And if a person can't find housing or is marginally housed or at risk of losing their housing, it creates a lot of stress. And in reality, these four things you've mentioned coming together, I think all of us, even those of us who consider ourselves extremely lucky, are affected by what's going on around us. And I know even for myself, sometimes I go home at night and I'm overwhelmed by all of these things, and I'm not even aware that that's what's causing my angst. But to get back to what you were asking me, the thing with housing is that there's very little, and if we can find housing for folks, it's usually more than what they can afford. And over the past several months, we've seen this sort of housing crisis cost affecting seniors because they've had their payments reduced for a variety of reasons. Some have gotten CERB and they weren't to get it, and then it's clawed back, and then they don't have money to pay their rent. I mean, these are kind of complex situations for people that are really, really awful. I mean, especially when somebody is in a situation that's not of their making, right? The landlord is doing renovations or whatever, and they can't find a place. I think, for us, the opioid crisis is front and center. We gave out 10,000 naloxone kits last year. We try to educate as many people as possible on how to use naloxone. But the bottom line for me is that the situation is way past anything that can be saved or helped by administering naloxone. There are not enough on the street workers or people like myself, because I get called out to help somebody to save all the lives that need saving. And years and years and years ago, and I have advantage of age and a historical memory, when the 4 pillars were introduced in the 1990s, harm reduction was one small part of it. I mean, there were 4 pillars, and the other, we've gone with harm reduction, and I'm not being critical of it, but unfortunately we abandoned the other 3, which was prevention and treatment and enforcement. And I think that that's coming back to bite us now. I think that what we're doing is completely inadequate, and we really, really have to stop talking and and take some action. So,
Yeah.
in terms of the climate change, I mean, I think we all do as much as we can, with recycling and things like that. But, again, when you look at the big picture, it's overwhelming for an individual. And when I get on the road and I see the number of cars, both, traveling Highway 1 east and west, and I think you're going to get all of these people out of the cars. It's never going to happen, right? The way we're going. Those folks need those cars to get to their livelihood, to support their families. And like, I just think, it's, I'm sounding like doom and gloom, and I'm not, but I feel like we have to get real about what we can do as individuals, what we can do in community, what we have to pressure the provincial government and the federal government to do. And I think we have to stop talking and start moving on these things. So.
Yeah, you bring up a really good point there about the harm reduction, Linda, that essentially naloxone is a very downstream solution where somebody has almost died and it's trying to save their life rather than going for a more preventative strategy. It's absolutely true. I just want to let folks know that if you're on the Zoom with us, you can submit questions. We'll have time for question and answer at the end. And if you're on Facebook, you can actually join the Zoom still. The link should be there. But we do have question and answer there. So we look forward to seeing your questions. Esther, what are some trends that you're seeing in your work sort of with these overlapping crises?
I'm on mute here. I think that I was actively listening to Linda, right? Because I agree with everything that she says. And I think what I would, continue from what Linda is saying is that, that these crises that you've described are all disproportionately affecting vulnerable populations, the populations that organizations like Purpose and Umbrella Co-op serve. And it's also a result of like the lack of investment in what you're saying, Nadine, the upstream, right? The lack of investment in the upstream services that would prevent these emergencies and these crises from happening. And I guess how we kind of frame it in the healthcare industry is we refer to these we talk about it in the context of the social determinants of health, right? And that's kind of healthcare jargon for what are those social and environmental factors that are impacting your health and your wellness, right? And those are things like, of course, like housing, access to food security, as Linda's describing. It's also about income, and like for the populations, the newcomer populations that Umbrella Co-op serves, I mean, that would also include things like your race, your immigration status, and also cultural barriers you are experiencing. So I think that like with the vulnerable populations that you're already at, in some cases, is working on survival mode. And then when you add something in like an opioid crisis, like the pandemic, it is disproportionately affecting that precarious status, that precarious livelihood that you're already experiencing.
Thanks for that, Esther. And I think that's a very, it's a complex topic, the social determinants of health, but I'm just going to reiterate what you said, because I think it's so important, which is that our health and well-being isn't innate to us. It's not necessarily genetic. It has a lot to do with our social status, like things like how we have housing, if we have access to good food, what kind of work and education we've had access to. I think that's such an important point, and I just really want to reiterate that as a learning opportunity for folks. So the City of New Westminster has proposed a kind of emergency response to crisis. So we know that if you see somebody on the street who's struggling, if you're having a mental health crisis, the service that's currently available to us is you call 911, right? And often who shows up is police, fire, and then paramedics, quite often in that order. And there seems to be a pretty major gap in services relating to healthcare and wellness and outreach. And so we've proposed to be a pilot city, trialing a new model of community response, which would be offering different types of workers, like maybe a housing outreach worker, maybe a mental health support worker, maybe a cultural worker or an elder. So from that frame, in that emergency response idea, Esther, what do you think would be really important to keep in mind as we're building up that type of community response?
Yeah, I think that maybe again, the way that I would answer that would be through the healthcare lens and from the populations and from the perspective of the populations that we work with. I think it's really important to keep in mind that for newcomers anyways, often there's a language and a cultural barrier. And I'm really glad that you mentioned, and as usually as fundamental barriers in addition to other barriers. And I'm glad that you mentioned cultural barriers, because that's one of the models of one of our working models at Umbrella Co-op, is that all of our services are accessed through cultural barriers. And I can maybe describe like a personal experience that I had when I started working at Umbrella Co-op. I was the program coordinator for the mobile clinic, and we were out in the Fraser Valley holding a clinic, and there was a patient, a migrant farm worker came to us, a patient that presented who the physician suspected that he may have a case of tuberculosis. So I, along with one of the other team members, took this patient to the emergency room at the hospital, and then the receptionist there. And I was the one who I was kind of doing the brokering because the patient didn't speak English. So then the receptionist is like, well, I'm sorry, we can't admit this patient because the person who processes private insurance doesn't work on Sundays. So the migrant farm workers, their visa program, as part of their contract to come to work in Canada, they have to buy their own health insurance, which they do. But then, so at the hospital, the receptionist was trying to deny this patient access to care based on this, that there wasn't an administrator ready to process this. So I really had to advocate to speak to her supervisor and that person's supervisors for quite a good 30 minutes or so before we were able to convince or find somebody that was willing to process this person's health insurance and admit them to the emergency. So, I mean, it's maybe not directly answering your question, and we're just demonstrating that there are multiple barriers there that are not visible to mainstream services and whatnot. So anything that is bridging those gaps is I think necessary as part of an emergency response.
Thanks for that, Esther. And I'll pose that same question to you, Linda. When we're considering that different model of like a crisis response for people who might be having, on the street, having a crisis, or in their home, having maybe a mental health crisis or something like that, what would be important to keep in mind as we built up a different model for responding to that?
Well, I think there has to be a different model. And I think, the police force, the members of the police force themselves have recognized that they've gone way beyond their role or their job description as keepers of the peace, or working to solve crimes. But it's tricky, because you get a call and say for example you've got somebody who having a mental health crisis, and you send out a mental health worker or a social worker or whatever, whomever. And, it turns out that there has to be some protection, that it's a dangerous situation. And that person, the mental health worker is not trained to deal with a dangerous situation. So, I think there has to be some work there to pair people up. I'm not sure it has to be police. But some recognition that there are situations where that may get out of hand and become dangerous very quickly. I do know from, our experience here and what I've seen with, some of our staff and some of the clients, that just the approach, how you approach people, how you talk to them. A lot of it is kind of recognition and respect. And you get a very different response if you treat people with respect, and that you can help them see that you're there to help and you're willing to listen and understand. So, to me, those are the things that we have to keep in mind as we redesign how, instances are attended to or occurrences are attended to. When I walk out on the street, one of the things I see is people walking by, people laying in the sidewalk and not paying them any attention. They don't want to get involved. They're frightened, any number of reasons they don't want to get involved. And they do nothing. They don't call 911. They do nothing. They just walk by very quickly. And so it starts there, right? It starts at people, if nothing else, getting some help somewhere, whether it's going into a local business and saying, can you help this person, or can you call 911 or whatever. So it starts there. And then for those of us who are okay, it's reaching out and saying to the person, are you okay? Do you need help? Would you like to go somewhere, or do you need food or whatever? And there's kind of steps in terms of the response to your full out, somebody needing naloxone or somebody needing medical care for whatever reason, right? So I think there's no one answer and there's no easy answer, but I think it just needs some thinking through and recognizing, the different situations, being able to identify them in some way and responding. So it's I think my answer is fairly practical. Like I'm not working at a high level here, because for us, it's all about action. I mean, yes, we can sit at the end of the day and have a glass of wine and talk at high levels about these issues, but on a daily basis, you're on the ground and you're giving mouth to mouth to somebody who, has vomited or whatever. I mean, it's pretty, I don't want to gross people out, but this is what we're talking about in terms of responding, right?
Yeah, I think it's a really good point that often we're looking for perfection in our response, and action is better than perfection.
Well, you're not going to get it. You're not going to get perfection.
No, there's no such thing. Yeah, it's no such thing in complex issues. I also just want to make a point too, that when we're talking about people with mental health issues, I do think it's important for the people who might not have this background to know that people with mental health issues and disabilities, in fact, are more often victims of violence and perpetrators of violence. And I think that's important to say here as well, because there's a lot of stigma attached to these issues. So just want to say that as well. So we're going to just wrap up the roundtable conversation and move on to question and answer period. So if you are on the Zoom, please do drop a question into the Q&A. Otherwise, I'll ask a million questions because I have so many for these two people. So just to wrap up with the last question. So Linda, what if there could be one action or 3 actions that you want individuals or governments to take right now, if you could sort of take a magic wand and make it be, what would be top of your list for that concrete action that you were talking about?
Well, I think probably the thing that we need right now is access to safe drugs. Yeah, I mean, this is what people need. The drug supply is so toxic, and there's such a lot of things in the drugs now that we can test for fentanyl, but that's just a drop in the bucket. And so you really need to have higher level testing available everywhere. And but if we I mean, even with a safe drug supply, you probably need testing, but first and foremost, a safe drug supply, and recognizing that it's a health issue, and yeah, I'm not going to get into moralizing, so I'll just leave it there.
Yeah, that's a powerful one. Thank you for saying that, Linda. I think it's been controversial in the past, but there's been many calls from the impacted folks, research studies, all of that. So totally with you on that. Esther, over to you. If you could sort of take one action, make something happen, what's top of your list?
I guess in like a really kind of magical world, I think it's what you addressed in the opening video, right? What we need is equity, right? And we really need a redistribution of power and resources. But like for the sake of this conversation, what I might say relevant to on a municipal level is kind of better collaboration between the three levels of government. An umbrella co-op as a healthcare facility, we have provincial legislation and funding and whatnot, but serving newcomers, we have federal funding and legislation and policy and whatnot. And we need to bridge those things while the things play out on the ground on the streets of New West. Right. And so I think if I were to wave a wand, it would be just sort of like to move away from these siloed operations and figure out how we could collaborate a little bit better. And we saw an example of that with the pandemic. Umbrella Co-op was the site for a few of the vaccination clinics, right? And we really were allowed to provide low barrier. We didn't require identification or a health card status. And so a lot of these barriers were removed from us for providing the services. And we were really able to access a lot of people who were having trouble getting their vaccinations otherwise. So that kind of collaboration and elimination of red tape, I think is something that would be really helpful for all of us here in New West.
Yeah, it's not glamorous, it's not sexy, but oof, it's needed. So yeah, thanks for talking about that. Okay, I'm going to move over into question and answer. So there's actually a question that came in about the decriminalization of simple possession of street drugs and what the city's position on that was. And I think Linda really spoke about that very eloquently, and the city has supported actually calls for this as well. So I think we've actually covered that off as Linda's sort of top of list thing. We had another question come in about a sanctuary city. And this is actually something that the city of New Westminster is working on and developing policy on. And I know, Esther, this is something that would be in your in your bailiwick there. Can you talk a little bit about what a sanctuary city is and how it might actually help some of these issues that we're seeing?
Yeah, I think I can't purport to be an expert on sanctuary city, but more or less a sanctuary city is where you have anyone can access services without, regardless of their immigration status. So that's kind of the idea of a sanctuary city. And I do want to like just tip my hat off and give a shout out to New West for their very thoughtful consultation process in developing the policy. I have to be honest, I haven't read the final version, but just the consultation within the community and the approach to understanding what the benefit of this will be. And I think on your website, like I can refer people to the City of New West website, because on there it does describe a little bit of circumstances of why somebody would end up in New West, right, without having an immigration status that a permanent citizenship, permanent residence or citizenship status. And there's many reasons for that. There's people who are claiming asylum who don't have a status yet. There's people who are in the process of their refugee claims. There's people who have been sponsored by a spouse, and then that spouse they could be in a violent relationship, or they need to leave that spouse. And there's a variety of reasons for why people would end up in New West without a permanent residency status. So I think the fact that people having access to services irrespective of their status is something that's really important. And from a healthcare, like the pandemic is just a perfect example of why that's important, because we want, the pandemic is a societal problem. It's a community problem, right? We all and becoming vaccinated, we don't want to impose. Early on, there were multiple barriers for people that didn't have, depending on their status, just didn't have access to the vaccination, right? And that it would be counter to what we're trying to achieve as a community.
Yeah, thanks for sharing that, Esther, and that work on that. Yeah, and it is a problem, because if people need health services, if they need to call police, fire, ambulance, if they want to access city services, like even our recreation services, they can't do so because they're afraid of being deported back to a place that might not be safe for them, etc. And I will also note that it was my colleague Chini Doss who's really been a champion of this, and the school district in US actually was very early adopter of a sanctuary schools program, so that kids who are here have access to education no matter what. And that's such crucial work and important work that I think we should be really proud of as a community. Okay, moving on to more Q&A. So so there's a question here about what are some more big ideas about what would make a difference to your clients on a local level, and how can other community organizations play a positive part in assisting these crises? And so this, I can see who asked this question. If, like, let's say they're part of like a different type of community organization, like an arts organization, for example, is there some way that they can play a part in sort of furthering this work on behalf of the most vulnerable people in our community? Linda, maybe I'll put that to you if you have any ideas. That's a big one.
Well, it's really interesting because we work with peers, people with living a lived experience, and we've created a peer network that has been ongoing for close to 3 years now, and we meet every week. And today we had a poetry workshop, and of course none of us know very much about. Well, some of us don't know very much about poetry, but anyway, we went ahead and did this poetry workshop. And at the end of it, I think the 12 people that were attending all wrote poems and read their poems. And it was amazing. We had a great time, and lots of laughs, lots of getting to know each other, lots of, kind of allowing themselves to be vulnerable. And I thought to myself, well, this really worked. And so if we could have people who really know how to do a poetry workshop or a drama workshop or whatever come in and do that, it would be wonderful. And of course, though, our problem is we don't have a lot of money to pay people. And the arts folks, they don't have any money. So that's the dilemma. And then, some of it is just getting, for other people who are not, who don't know our clients and the people who come to Purpose, getting to know them, getting to feel comfortable, and, creating that little bit of community that would be here, right? Yeah.
Yeah, that community building piece, that's fantastic.
Yeah, and every, like, we have a little community here, and then you have one at City Hall. I mean, there are communities within communities, right? And so just because we're all living in New Westminster and we have good intentions, that's not enough. You actually have to work to, make the intentions happen, right? You can't just assume that people are going to come and be comfortable and whatever. You have to work to make it happen.
Yeah. Esther, did you want to add anything to that, or you don't have to?
No, I would love to add it. And it really is an addition. Like, I would also just connect it back to, I believe it's one of the pillars of the city of New West is this idea of a sense of belonging, right? So if I understand the question, it was, are other community groups, if you're part of a community group, what can you do to kind of create this community of care, if I understood the question correctly? So I would say, just to echo what Linda, whatever it is that your organization is a specialist at, if you can create a sense of belonging and a sense of community around that, I also, not only does it create the idea of community and sense of belonging, I equate, or I think a strong lens of safety is around community. If you have community, there's a lot of safety in that.
Mm-hmm. Oh, I feel like that was a mic drop moment there, Esther. that was so beautifully put on top of what Linda said. That was so great, and really appreciate that perspective. Okay, I'm going to go back to my Q&A here. So there's just some love coming in as well. So much appreciation for you two being here. There's a comment here about putting more police on the streets as a first contact and saying that we wouldn't then have to pay for services. And I'm just gonna comment on that, which is that police are services that we pay for. The City of New West, a huge proportion of our budget goes to policing costs. And in fact, we know that preventative services are actually much, much cheaper, right? So if we actually address people's needs, immediate needs, food, housing, those are the first things that come to mind, but also, safe drug supply, I think, is another big one. We know that there's evidence that this would reduce a lot of the need actually for policing response, and they could then focus on the actual policing work, not the sort of community service work. So I think that's an important one to answer, is this answered as if policing is free. But one of the issues is jurisdictional, that policing falls within municipal jurisdiction and municipal budget. Housing and healthcare falls within provincial budgets. So a little bit of sort of going to Esther's earlier point, I think it's important for people to understand the sort of jurisdiction piece there.
But Nadine, can I ask a question? Can I ask a question?
Yeah.
So, we have somebody who takes some toxic drugs, and they're out of it. They need naloxone. They get their naloxone, and we call 911 as part of the process. And we have arrived, as you said, the police, the firemen, and the first responders, or the ambulance. Sorry, the police, fire, and ambulance. Do you know how much that costs? Like 2 hours, maybe an hour of each of those folks sitting, coming and being there and attending. And in the end, the person is most of the time not going to go in the ambulance for a variety of reasons. And I'm wondering I don't know why we do that. I don't understand why, the three groups haven't worked out between them. Well, this is how we can cut costs and do it more effectively and use that money that, is on the street to go to programming or more staff or whatever. So maybe you could enlighten me.
I think the question, it's a really good question, Linda. And it's that the problem is that people, it goes back actually to Esther's point about collaboration, right? Which is, and about ministries as well, right? So there's certain issues that are in within Ministry of Health. There's certain issues within Ministry of Housing, and those ministries shift and change sometimes names. So I think it's actually fairly, if we set our mind to it, we could collect this data on exactly what a kind of call might cost. And I can tell you that, for example, our bylaw officers have reported responding to a 93% increase this year in calls relating to mental health and homelessness. So we do know that there's number increase, but I don't have an exact number within the City of New West. But part of our pilot project could actually be collecting that data. And it's also, I think, making a good business case why this makes good business sense. There's been studies that are parallel to this, but not something directly on this topic that I've seen anyways. But I think you're exactly right, though, that we should be collecting data on this and finding out exactly what services are responding, how much they're costing, and what would be a better use of that money that actually might go upstream and fix the problem. But yeah, really, really good question. I'm just scrolling through the questions now. There's so many here. So there's a question here. Are there any indications that the federal and provincial governments about the funding to implement new approaches towards these issues and sort of go for those, what this person's referred to as the missing legs of the strategy? I mean, I can speak from the City of New West. I think the government has indicated in some ways that they are, but there's a huge gap between indication and also the need in the communities is so great. Esther and Linda, are you seeing, Linda, are you seeing indications from senior levels of government within your organization, or is it something that is still pretty opaque and hard to see that they're moving in that direction?
Yeah, I really can't comment in any meaningful way on that. I have recently put in a proposal to the federal government, and which, I'll wait to see if it's funded. If it's funding, I would probably say, yeah, they're responsive, but I honestly can't say. I think yeah, I don't want to go there. Yeah.
Mhm. Fair enough. It's a really hard question to answer, and I think
I don't mind answering.
yeah. Oh, go for it. Yeah, what do you think?
I think it's pretty opaque. It's pretty opaque. I would say that, like, on given, you know, what we've learned from the pandemic, and like things that what we've been talking about upstream solutions and addressing upstream problems, I would say that we are not seeing from various levels of governments, right? The calls to action, right? That we actually need to shift, because this is a major shift in the way the funding and the policies have been developed. So I think that, I mean, that's something for us to think about in terms of a community of care. Like, what are the pressure points? Because it's not like they're going to hand it to us. It's not going to be handed to us.
Yeah, thanks for that. That actually leads really nicely into the next question, which I'll point towards Linda, which is, how can we help with that advocating for that, the safe supply issue? Do you see opportunities to get involved with that? Because I do know that there are campaigns that have gone, and there have been a lot of asks. Are you seeing opportunities for community members to be part of it?
Yeah, you know, it's like any other campaign. And I think that if, you know, for example, if people were interested in advocating for safe supply and they wanted to get in touch with me, I'm happy to, you know, help people get it. We'll organize ourselves, and we can do all kinds of things to bring, you know, the attention to the MLAs, and, you know, like that, we have to be a loud voice, and it needs to be, we have to be meaningful loud voices. And I hate to say it, but, you know, it has to be, sometimes the voices have to be the people who can influence, in the sense that they vote, right? I'm kind of getting close to the bone here, but, you know, oftentimes, you know, vulnerable people don't get the attention they need because they don't vote, right? They don't come out. And so if we get down to, you know, really making things happen, we have to have these hard discussions about how to make them happen. And, you know, yes, it'll be hard, difficult work, and sometimes not too pleasant, but yeah, we could do it.
Yeah, and I think you had a good point earlier about the peer network. If people wanted to join the peer network, they can get involved with or get in touch with Purpose Society and get involved with that work as well. Yeah, and you know, the peers, this is what makes a difference for people, is being able to contribute and make a difference. And you remember maybe a couple of years ago, one of the women in the peer group came in one day and she said, you know, we have to have public toilets. This is just awful, you know, people doing their business wherever. And they sent a letter. I think they went to council or whatever, but anyway, it ended up being in the local paper. It ended up being in the Sun. And then there was some TV coverage, and people were interviewed, and oh my goodness, you know, like, they understood, I do have a voice, you know, and I can exercise it, and people will listen. And that was one of the great things that the peer group did. So yeah, and that makes people feel good. When you contribute, you make a difference, you know, you have some influence. That's pretty amazing, right? We take it for granted, right? We take it for granted, but there are so many people who don't. Right? Yeah, that's a great point. There's a question here about, so a lot of what we're talking about is sort of upstream solutions, right? Like, there's this metaphor of the river, that if people are floating down the river, you could catch them, you know, and pull them out, catch them and pull them out. But really, to make a long-term change, you need to go upstream and see why people are falling in. So using that metaphor, you know, there's a lot of upstream changes that need to be made. And a lot of those do fall in the hands of federal and provincial governments. And I think all of our organizations do advocacy work around that and talk about what the needs are. But is there something in particular that you think that the city should be doing while we're waiting for these? It's your chance to give it to the city and tell us what you think. Esther, I'll go to you first. What more could the city be doing to help people in our community?
That's a tough one. I think like one of the things that the city is doing, and maybe they can do more of, or I don't know, but is funding the community services, right? And I know that they're doing that. I think having the multi-year grants is something that's really supportive of organizations that are trying to provide community services. So I guess making those as kind of as accessible as possible to community groups. Maybe I'll pass it to Linda, and let me see if I can think of anything else.
Yeah, the municipality, I don't think is in a strong position to fund. Because if the money has to come from somewhere, and it'll come from the residents, and of course I think people are taxed enough. I don't think there's much left for paying more user fees and more taxes. But what I think the municipality can do is, they've already started to do it, and they do it in a really big way, is be in touch with the community, know what the issues are, and then rock the boat, right? Go and, harangue, whatever has to be done, that, the provincial and federal governments continually, with a plan, be very specific about what we need, and try to get it. Again, I think it's, with my memory of how things have unfolded, we often have a flavor of the month. So something is sexy this month, and we all jump on the bandwagon. It's usually something that we imported from the United States because we think they do things better. And after a while, that falls off the table, and we start on something different. And we have to stop that, because prevention and long-term approaches are not sexy. They take time, and they take money, and the outcomes are baby steps. But that's what we need to do. That's going to take us where we want to go in terms of, your model community. So that, I think, is what I would be very grateful if the municipality did. Yeah.
I did think of one thing. Is I know that other municipalities use this model of the land that they own, or the properties that they're owning, that they're making sure that there's allocations to these social services and the upstream services, though providing that sort of rental space, or just that's something I thought of.
Thanks for that. Yeah, and Linda, I would love to. I'm gonna just tell everybody now. Linda told me to do it, so I'm coming haranguing you. So taking my marching orders. Okay, I think we have time for one more good question here. Well, I'll maybe answer this one about some citizens who might be interested in creating a community of care at a community level, and whether or not there's grants available for getting to know neighbors better. And I would say, yes, there absolutely are. The Vancouver Foundation has neighborhood small grants, which are amazing. And there's been so much good work done from neighborhood small grants. There's also the City of New Westminster also has grants that you can apply for. You can look on the city's website. Send me an email, and I'm happy to send you the information. But there's also been really good, like Esther and Linda have said, that City of New Westminster funds some of the programming there, but there's also some smaller scale grants that are more accessible for community members too. So yeah, happy to connect you with those. I would also say that a lot of nonprofit organizations, community organizations are doing that work. So you could also consider getting involved, in some of those projects and programs that are already going on with, arts organizations, the Poetry Circle, if you want to write some poetry at Purpose and whatnot. Okay, last question here, and this is a biggie. So, and I think this speaks to one of your original points to Esther, about the social determinants of health and the importance of poverty in that. So no, we will not answer this in 4 minutes, but could you just give us maybe a brief idea of what is something that we could do now to break the cycle of poverty in our community? Linda, I'll maybe go to you first on that, because I know that your organization has worked with people in poverty for many a year.
Well, they have to increase the income assistance rate. I mean, people are trying to live on nothing. Yeah, and recognize that, people with specific conditions will require extra money for medication or whatever, but, one size doesn't fit all. And so looking at individual people's needs and increasing income assistance rate, yeah, that's the first thing, right? I mean, there's this whole thing about, you can get into a discussion about, in terms of what hourly rates are for folks, and that's a whole other different issue. But in terms of the government, what people are getting is just inadequate.
Yeah, it's deeply below the poverty line.
Oh.
And Raise the Rates campaign has been working on that. So folks, if you want to get involved in Raise the Rates, that's a really good one. Thanks for that, Linda.
We shouldn't have to be delivering hampers to folks. People should be getting enough to pay their rent and eat and their medications, at least, right? And they're not even close.
Yeah, so important. Esther, what would you say?
Maybe I would completely echo what Linda is saying in terms of raising the income assistance rates. And then I would one up it also to having a universal basic income. Like we kind of tested it out with the CERB during the pandemic, right? So it's possible. And we know that is also a piece of legislation or policy work, right? That can alleviate a lot of poverty.
Yeah, and there was a guaranteed income bill that did go to Parliament, the last Parliament, and it obviously did not pass. So, okay, I think we could actually talk about this all night, because these are very deep, complex, and intersecting issues. But I believe that is all the time we have for this evening. So I just want to again thank you two for sharing your time and your wisdom for us, and thank you for the work. Please pass along our thanks to your staff and your volunteers for the work that you're doing in our community, because the community of care is already happening. It's happening in your organizations. I think we just want to expand that out more broadly, and really support that, so everybody is living in, like Esther so beautifully said, a connected community where we know each other and we're able to take care of each other in a really beautiful, compassionate way. So thanks to everybody who tuned in tonight to listen to this conversation. We will have more New West Matters conversations on other topics coming up. Again, if you want to contact me, if you want more information about the work that the city's doing on this, you can email me at nnakagawa@newwestcity.ca. And there is information on the city website about the submission if you want to read it in greater detail and find out all those things that we've advocated to the provincial government for. And if you want to give us some feedback, we'd love to hear from you. So thanks everybody for being here and being part of this conversation. And I hope you all stay really well.
Thank you. Have a good evening.
Yeah, you too.